Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with the neuroimaging concepts and we are discussing spinal cord disorders. In this episode, we shall discuss deficiency and toxic disorders of the spinal cord. So, neuroimaging concepts, part 39, spinal cord disorders, part 7, deficiency and toxic disorders. So, the deficiency and toxic disorders. The deficiency of nutrients affecting the spinal cord could be because of vitamin B12 or vitamin E, copper, folate. So the deficiency states of the spinal cord could be due to vitamin B12, vitamin E, copper, folate. The toxic disorders affecting the spinal cord disorders could be due to nitrous oxide or hepatic failure. So the toxins affecting the spinal cord disorders could be nitrous oxide or hepatic failure. So this is the subacute combined degeneration of the spinal cord. So there is a systemic degeneration due to vitamin B12 deficiency. Vitamin B12 is especially useful for myelination of the tracts and the nerves. And therefore, when there is vitamin B12 deficiency, the myelinated tracts and the nerves get affected. So amongst the nerves, the large fibers are well myelinated, so it results in large fiber neuropathy. Amongst the tracts, we have three important tracts: corticospinal tract, posterior column, and the spinothalamic tract. Of these three tracts, spinothalamic tract is the least myelinated tract, and therefore vitamin B12 deficiency usually does not affect the spinothalamic tract. Whereas posterior column and pyramidal tracts are well myelinated tracts, and therefore when there is vitamin B12 deficiency, corticospinal tract and posterior column get affected. So amongst the tracts, vitamin B12 deficiency affects the pyramidal tract, that is the corticospinal tract, or posterior column. It spares the spinothalamic tract because it is least myelinated amongst these three tracts. Amongst the nerves, the large fibers which are well myelinated get affected. That means it produces large fiber neuropathy. The small fibers which are less myelinated are not affected by B12 deficiency. So it spares the small fibers. So it results in usually a large fiber neuropathy. So this is the subacute combined degeneration of the spinal cord. You can see this is the spinal cord. The posterior columns which are placed posteriorly are affected a lot. So it results in the signal wherein the posterior column, an altered signal wherein the posterior columns are present. And here you can see the corticospinal tract and the pyramidal tract being affected, and amongst the fibers, the large fibers get affected. So this is the sagittal and this is the axial T2 MRI of the cervical spine in subacute combined degeneration, showing the abnormal hyperintensity in the posterior columns. So here you can see the abnormal hyperintensity in the posterior columns here in the sagittal section, and if you see the axial section, it is here, abnormal hyperintensity. So these are the tracts and the nerves which get affected: the pyramidal tract and the posterior column, and large fibers in the large fibers. So subacute combined degeneration, vitamin B12 deficiency, posterior column and pyramidal tracts are affected, large fiber are affected. So these are the important concepts of the toxic and nutritional deficiency of spinal cord disorders. The other important concepts of clinical neurology I put in a book called Exam Oriented Clinical Neurology. This book is written by me, Dr. Sreenivas, published by White Army. This book will be very useful for students appearing for clinical neurology exams. So if interested, this book could be purchased. The other book I've written is Focused Neurology. All the important theoretical points of neurology I put in a question and answer format in the book Focused Neurology, written by me, Dr. Sreenivas, published by CBS Publishers and Distributors. This book will be very useful for students appearing for oral exams or Viva exams. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online from Amazon. So if you have really enjoyed my concepts, please like and share the link, but please subscribe to my YouTube channel Dr. Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my web page, Dr. Sreenivas Concepts. Thank you. Bye.